All right, welcome back to Action News Jax Health Alert segment. October is Breast Cancer Awareness Month. And while some of us are aware of the pink ribbons we might see out and about, many still aren't aware of how early detection can really play a role in treatment and when you need to get a mammogram. So joining me in the studio here, we got Dr. Scott Ackerman from the Ackerman Cancer Center. Thank you for joining us. We're excited to see you again this morning.
Thank you for having me. It's good to be here.
Yeah, we appreciate it. We'll jump right in here. So we often remind people, hey, go ahead and get your regular mammograms, but self-checks, they are also important. So what are some specific early signs of breast cancer that people should look out for?
So every woman should know, it's pretty common to know that a lump in the breast. That's what we always talk about. Do breast self-examination once a month, same time of the month, and feel for a lump in your breast. But there's other signs and symptoms of breast cancer besides just the lump that you always hear about. So one thing is maybe some swelling of the breast, a little bit larger than the other breast, maybe some redness of the skin. Is also a thing to be concerned about. We have this thing called orange peel skin, or it's, in French it's peau d'orange. We use that term in medicine when the skin has a little dimpling in it and looks like the skin of an orange. That's a sign of potentially breast cancer deeper in the breast. If a nipple becomes inverted, or if there's some discharge from the nipple, especially blood from the nipple, those are things to be concerned about as well.
Yeah, those are good changes to look for here. And also, we often talk about women getting their mammograms, during their self-checks as well. But breast cancer in men, it isn't talked about as much, and it's rare, but it can still happen. So what are the risk rates for men?
Yeah, so men also have breast cancer. So Breast Cancer Awareness Month, certainly we talk about women and breast cancer because the breast cancer is most commonly in women. There's nearly 300,000 women who will be diagnosed in America this year with breast cancer. For men, it's about 2,800, so about 1 in 100. So for every 100 women we see with breast cancer, we have a man with breast cancer. Even in my practice now, I think I have 2 men who are under active treatment for breast cancer. Now, there's no screening for men. We don't have men get mammograms or anything. But men should be aware of their bodies, like we all should be aware of it. Men and women should be aware of their bodies in general, not just for breast cancer, but for other issues and problems. But for men, if he feels a funny lump in his breast, that should be something that he should be concerned about. A change in skin color of the breast, something like that, see your physician. And certain men who have a genetic predisposition to cancer. You've heard of the BRCA gene. We've talked about that in the past. The BRCA gene is associated with increased risk of breast cancer. In women, we talk about BRCA gene. Well, men can have the BRCA gene as well.
Oh, wow.
So if you have a strong family history of breast cancer and the BRCA gene in your family, or you have the BRCA gene as a man, you should be doing your breast self-examination on a fairly regular basis.
Yeah, it applies to both. That is good to know. And also the guidelines here for women, when you talk about getting your mammograms, they seem to have changed a little bit. They say 45, and it seems to be moving up a little to 40. So what do you recommend for your patients?
So it seems like the pendulum's kind of swinging back. Years ago, we used to recommend that women get their first mammogram at the age 35 and annually after that. And then over the past 15, 20 years, it kind of swung and we said, okay, women really can wait till they're 50. But now it's kind of, what we found when we recommended that was that we're having more women being diagnosed with breast cancer at a younger age and more advanced and missed because they weren't getting mammograms. There's different societies that make a little bit different recommendations. There's the American Cancer Society, and there's all sorts of task forces that make recommendations. But I recommend that women get their mammograms annually after the age 40. And these are for women of average risk. So, but if a woman is of increased risk, meaning that she has a first-degree relative, like a mother or an aunt that had breast cancer, consider getting your first mammogram at age 35. Okay. And then if that's clear, then wait till 40 and get it annually. But if it's not, the radiologist will recommend maybe a little bit more frequent screening. And if you're really high risk, meaning that you not just have a family history of breast cancer, but you have a genetic predisposition of breast cancer, you've been tested, have the BRCA gene or something, talk to your physician and maybe you can get a mammogram at age 30.
Oh, wow. A lot of different ages there to consider. Thank you so much. Yeah, we appreciate having you, appreciate your expertise. Of course, October is Breast Cancer Awareness Month. So if you or a loved one are diagnosed with breast cancer, we do have some local resources available today to help you get financial support, like the Ackerman Cancer Foundation. You can find all of that information on our website at actionnewsjax.com.